Hi guys, Dr. Brotsky here. This is the 4th month of your pregnancy, otherwise known as gestational ages 16 to 20 weeks. That's what your doctor will know it as. So you're almost halfway done, which is exciting. This is the time frame when you usually find out the gender of your baby, so that's super exciting. Things that you can expect to be going through right now are to be enjoying your 2nd trimester. You should be feeling better, having more energy. You should be taking less naps, probably not being super uncomfortable yet. You probably don't have a lot of pelvic pain, although some occasional cramping can be expected. You can also start getting some leg cramps, and you might notice some sharp groin pain when you walk around too much or you get out of a chair. It's called round ligament pain. It's very common, but talk to your doctor about that. You also will probably notice fetal movement. So the average time frame that happens is 18 to 22 weeks. Most first-time moms will feel it a little later. If you've had a baby before, you may find that movement comes a little bit earlier. It may take a while for your partner to feel the baby move too, so that may not be until the 22 to 24 week mark, and it depends where your placenta is at as well. But you're going to intermittently start to feel your baby move, which is always reassuring and exciting. You're going to have probably more shortness of breath with activity, so you're going to get winded more easily. It's that your lungs are literally changing their shape and capacity when you're pregnant, even this early. So hang in there. It's not that you're out of shape, it's just that your lungs are doing what they're made to do. From a doctor's standpoint around this month, this is when we find out the gender of your baby. If you want to know, it's always fun for me to never find out with the patient, and then we're both surprised at delivery. I love that. But if you do want to know, then you can find out around this time frame. Your doctor can also go over some alpha-fetoprotein testing at this time. That's just a specific name for a protein that's drawn off of a blood draw from you, and it picks up a risk for spina bifida for the baby. So sometimes we'll do this to complete the early genetic screening that you might have had around 10 or 12 weeks. But if you opted out of that screening, you may not need this level at all. This is also a time in the pregnancy where you're going to probably get an anatomy ultrasound. This is recommended for every pregnant woman between 18 to 22 weeks. Usually we like to do it closer to the 18 to 20 mark. The benefit of waiting till 20 to 22 weeks is sometimes in obese patients, for example, you can see the structures a little bit more clearly. So some doctors will prefer to wait a little bit longer for that. You can either get a level 1 ultrasound or a level 2 anatomy ultrasound, depending on what your doctor feels is most appropriate. Level 2 ultrasounds are much more detailed. They're usually done at a high-risk doctor's office because usually they're done for high-risk patients. And if you have anything high risk in your history, such as a medical issue or a family history, or anything else is going on with the baby, or maybe you had some abnormal testing, then your doctor will recommend that you get a level 2 ultrasound, and that's always an extra layer of reassurance. Things that you can be doing right now are sleeping on your right or left side. Make sure you're not flat on your back. Drink lots and lots of water. You can start getting a maternity support belt if your belly's feeling heavy, and that'll really help get some of that weight off of your pubic bone and improve your ambulation a little bit. You can do yoga at home. That helps a ton with just back pain and stretching and the ligaments changing as you're going through this pregnancy. Also, you can discuss cord blood with your partner and see if that's something you guys are interested in possibly doing, because some of the companies do provide discounts the earlier that you decide. Also, some people around this time do like a gender reveal party, so if you have any ideas about that, this might be the time to get that done. That's it for month number 4. Thanks for tuning in, guys. You can also check me out on my weekly videos, and you can find me on drbrotsky.com.